Hello everybody. Today we are going to see about a disease which affects high-yielding dairy cows or the onset of lactation. Here is the case history. A recently cured animal was presented with a history of reduced milk yield, anorexia, coffee-colored urine, and pale mucous membrane. Can you guess what it could be? Whether it is babesiosis or leptospirosis or basilar hemoglobinuria or postpaturient hemoglobinuria or hilar hematuria or cystitis or pyelonephritis. Yes, it's a case of postpartum hemoglobinuria. I'll explain you about the differential diagnosis in the upcoming slides. This PPH is a metabolic disease that occurs due to phosphorus deficiency. It's a non-infectious hemolytic syndrome of adult cattle and buffaloes characterized by intravascular hemolysis, anemia, and coffee-colored urine. Occurrence of this disease is common within 30 days or 3 to 4 weeks after calving. Age of susceptibility is from 3rd to 6th lactation, and the incidence is high in winter due to more availability of phosphorus deficient plants like berseem and cruciferous plants like cauliflower, cabbage, broccoli, and kale. The next cause is loss of phosphorus through milk in high producing cows. And the next one is copper deficiency. We all know that the copper is an essential component of superoxide dismutase enzyme, which plays an important role in preventing oxidative stress to cell membrane. High molybdenum in soil and fodder decreases the absorption of phosphorus from gut. The next is feeding of large quantities of sugar beets, green forages, and brassica plants cause oxidative injury to RBC as these plants contain hemolytic or oxidative toxins. In this pic, you could see the members of brassica species. Here you could see sugar beets and berseem. The next etiology is feeding diets low in concentrates or cereals. High calcium and phosphorus ratio decreases the phosphorus absorption from gut. The high risk period is the transition from late gestation to early lactation, and it is common in 3 to 4 weeks after parturition as it's a peak period during which the mineral imbalance is high. Economic impact involves low milk yield, cost of treatment, and increased case fatality rate. The next is functions of phosphorus. Knowing about the functions of phosphorus helps us to understand better about the pathogenesis. Phosphorus is very essential for glycolysis and oxygen transport. It promotes glucose uptake by RBC. It protects the cell membrane from oxidative damage, and it is essential for the formation of bone and teeth. Pathogenesis. First is the heavy lactation, which drains more phosphorus through milk, and second is low phosphorus diet, that is feeding berseem and cruciferous plants. These two factors directly influence the level of phosphorus and results in hypophosphatemia. As we see in the previous slide that phosphorus is essential for glucose uptake by RBC, this hypophosphatemia will result in a decrease in RBC glycolysis and ATP synthesis. A marked decline in the intracellular ATP production in the RBC results in altered function and structure and increases the osmotic fragility of RBC membrane. The next factor is oxidative toxins containing plants like sugar beet, brassica plants. It results in oxidative injury to RBC cell wall by causing peroxidation of the phospholipids of erythrocytic lipid bilayer. The next cause is hypocuprosis, that is copper deficiency and molybdenosis. It alters the activities of superoxide dismutase and ceruloplasmin and weakens the antioxidant system of RBC. All these factors leads to hemolysis of RBC and reduces hemoglobinuria, anemia, dehydration, and jaundice is seen in the later stages of the disease. Death is due to anemic anoxia. Coming to the diagnosis, it's based on clinical signs and case history like calving history and type of nutrition followed, urine analysis, hematology, and biochemical test. First, the clinical signs. Coffee colored urine is a premonitory clinical sign before anemia. The mucous membrane is pale initially, indicating anemia, and later the mucous membrane turns yttric, indicating jaundice in the later stages. The acute stage of the disease extends from 3 to 5 days, and recovery usually takes several weeks. The other signs include tachycardia, decreased milk production, anorexia, depression, dehydration, rapid and shallow breathing, and secondary ketosis due to anorexia. and death is due to anemic anoxia. Here you could see the pale mucous membrane, and the second picture haemoglobinuria. In this video you could see a cow voiding coffee colored urine. It's another cow voiding dark red urine. The next is urinalysis. Whenever you see red or coffee colored urine, you can suspect hematuria, haemoglobinuria, and myoglobinuria. If it's a case of hematuria, after centrifugation of the urine sample, the RBC net will settle down and form sediment. In case of hemoglobinuria, RBC do not settle down even after centrifugation. The sample will remain as a homologous fluid. In myoglobinuria, take serum sample and see the color. If it is pink, it's hemoglobinuria, and if it's clear, it's a case of myoglobinuria. In the first pic, you could see RBC settled at the bottom of the test tube. This second picture shows the comparison between hematuria and hemoglobinuria. In the first two test tubes, it contained uncentrifuged urine, and the next two is centrifuged. The test tube that contain hemoglobin will remain same even after the centrifugation. In this picture, you could see the urine dipstick shows the presence of hemoglobin. Next is hematology. Examination of the blood reveals hemolytic anemia, reduced PCV, that is packed cell volume, mean RBC count, and reduced hemoglobin, and there is an increase in erythrocyte sedimentation rate. Next is the biochemical test. The blood inorganic phosphate levels is less than 4 mg per deciliter. In severe cases, it may go still lower, that is less than 2 mg per deciliter, and the normal range is from 5.6 to 6.5 mg per deciliter. Next is treatment. The ideal treatment is administering 60 g of sodium acid phosphate intravenously diluted in 300 ml of distilled water. To prevent recurrence, 100 to 120 g of oral sodium phosphate salts can be given at 12 hours interval for 3 to 5 days. For severely affected animals, 4 to 5 liters of blood can be transfused. Crystalline fluids can be given to prevent hemoglobinuric nephrosis, copper supplement to prevent oxidative injury, and 5% dextrose to combat secondary ketosis. Injectable solutions containing organic phosphorus compounds such as butaphosphan, toldiphos contain phosphorus in a form that is not biologically available and are therefore unsuitable to treat PPH. Only inorganic phosphate is effective. Differential diagnosis. It's important to know which disease or condition causes hematuria and which disease produces hemoglobinuria. Hematuria will be present in enzotic hematuria, cystitis, urolithiasis, pyelonephritis, and oxalate poisoning, while this hemoglobinuria will be in postpaturient hemoglobinuria, leptospirosis, chronic copper intoxication, babesiosis, basilar hemoglobinuria, and brassica or onion intoxication. In babesiosis, if you suspect it's a case of babesiosis, take blood film examination and look for the parasite. In leptospirosis, there will be bloody milk from all quarters. Young ones are highly susceptible and pyrexia will be present. Basilar hemoglobinuria is caused by Clostridium hemolyticum, and it produces clinical signs like high fever, blood-stained feces, sudden death, and it is more common with liver flukes. In case of copper poisoning, there is no fever and severe jaundice. To rule out copper poisoning, we can assess the blood copper levels for differentiation. In water intoxication, we can assess the history of ingestion of huge amount of cold water. In pyelonephritis, hematuria will be present and frequent painful urination will be there. On rectal examination, there will be a cord-like ureter, absence of lobulations or enlarged kidney. In cystitis, there will be thickened urinary bladder, painful and frequent urination, and urine will contain RBC and pus cells. In urolithiasis, there will be distal bladder and the urinary retention will be there, and it is very common in castrated males. Enzotic hematuria is common in old animals and it's a chronic case. Control and prevention. Check the phosphorus content of the ration at the beginning of the lactation. Supplement phosphorus or bone meal. Correct the mineral deficiencies and eliminate the plant toxins from the diet. These are my references: the Mech Veterinary Manual and Veterinary Medicine by Peter Constable. Thank you so much for watching the video.